Hi, I'm Dr. Kathy Maupin. I'm the founder and medical director of BioBalance Health, and I'm here to talk to you about how BioBalance has changed some of my patients' lives. Today I have Rhonda, and she is here to talk to us about how she has done with BioBalance pellets and the other treatments that we've offered her. And welcome today, Rhonda.
Thank you.
I'm so glad you're here.
Thank you. Thank you for inviting me.
It's a pleasure. And you look like a whole different person today than you did when you walked in my office. And I think so many things had happened to you. One of the things that I want our listeners to hear about is the fact that you had breast cancer and you had the guts to come in and ask about treatment, because we do treat patients with breast cancer, especially receptor-negative patients like you. So could you tell me how the process of going through after breast cancer and not having hormones and how that affected you?
Well, they had told me that I was to expect menopause during chemotherapy. And about halfway through, I was slammed into it. And I had absolutely no idea what it was like. So there were several symptoms. There were probably too many to count, but the one that bothered me the most at the time were the hot flashes. They were intense, and I could time them almost like contractions. And it was seriously, there were days when it was almost 10 minutes apart, 20 minutes apart, and they were intense. And it went on through the night, so I had a very difficult time sleeping. I was living in a fog. I couldn't remember things that had happened day to day. Sexual intimacy with my husband was something that was the farthest from my mind.
And it's never the farthest from their minds.
No, exactly.
So it's always important for a relationship.
Exactly. And my husband has been so supportive and loving, and I wanted to share that part of myself with him, but I couldn't. And
so when you came to see me, you had several different problems. Besides having no hormones at all from your ovaries and having all of these symptoms, you also had an abnormal thyroid, Hashimoto's thyroiditis. Yes. And you were on thyroid, but not the right kind. And we looked at your numbers and helped you with that. And I believe that was one of the major changes that helped you get back to yourself. Can you remember how that changed when we treated your thyroid?
Right. Well, actually, I'd had my thyroid removed due to advanced Hashimoto's. And it had taken a year to a year and a half for them to try and balance my medication. And steadily, I was gaining weight. And that was very upsetting. And I had no energy. But that was the first thing that you did when I came to see you. Took a look at the information that my blood test gave you and said, hey, something's not right here, not right with your thyroid. We got to fix that. And you did. And within a week, I had lost 7 pounds. Within 2 weeks, I had lost 12 pounds. I had more energy than I could imagine. I was still in a fog, but...
How many pounds have you lost now? I think it's more than that.
I've lost 32 pounds in all.
That's amazing.
And without changing my diet or doing anything other than that.
Now, the testosterone pellets help you become leaner.
Yes.
And decrease belly fat and decrease just overall fat and give you muscle back.
Right.
So it burns calories while you sleep,
right.
which is my favorite part.
Right.
So we gave you testosterone and we changed your thyroid medication.
Right.
And you also had symptoms of fibromyalgia, is that right?
I had such intense bone and muscle pain that I was diagnosed with fibromyalgia and placed on narcotic pain relievers. And I have been doing that for more than a year when I came to see you. And that was the most astounding thing, this treatment, was that within 3 months, I was able to stop using the pain medication altogether. And that in itself just changed my life. I do too.
Now, you were telling me how your relationship with your husband is and that it's awesome.
It is.
Now, tell me about your conversation with him when he noticed how wonderful you were feeling and how your relationship had gotten back together.
Well, he first started trying to lock me out of the bedroom because...
Yeah, sometimes we have a little higher sex drive than usual for a few months.
Adjusting for him.
And then after that, it comes back to your normal self.
Right. But now he says that if other men knew about our sex life, that they would be lined up down the street. So.
Not for you, but for pellets, right? Yeah, that was it.
That's
it. So that's great. Now, Rhonda, you're a mother of 5.
Yes.
Is that right?
Yes,
Ages
5
what?
sons. 33, 31, 17, 15, and 12.
And they're all boys.
And they're all boys.
Have they noticed the difference in you?
Oh my gosh, yes, yes. They tell me all the time how good I look.
That's
They're
awesome.
enjoying me more, and I'm enjoying them more. We're able to talk and talk about things that I didn't have the patience for before. I couldn't even remember half of the conversations that we had.
And then they think you're having Alzheimer's or something.
Exactly.
But it's really just the estrogen going up and the testosterone going down. So getting the testosterone back has
Exactly.
changed almost every system. But also, you've done the work on losing weight, and you had the courage to go against what normal suggestions are from doctors to not take hormones after
Right.
breast cancer.
Right.
The fact is that when you take hormones the way we give it, both estrogen and estradiol, that your risk of having a recurrence of any type of breast cancer or having a new type is actually the same or lower than if you took nothing.
Right.
So in those studies, and those are all the recent studies, then you can have confidence in that, and I want everyone to actually know that there are studies that show that. So in any case, I'm proud of you, and I'm so glad
Thank you.
that you came today to talk to us and to tell us your story, because it's an amazing one. It's a huge transformation.
Thank you. And it's all due to you.
Oh,
I
thank you very
appreciate
much.
it.
Thank you. I love to see this. This is my joy of my day. My joy of my life is it used to be delivering a baby to someone. And now I love this so much more because I get to take care of their moms who are now the parents of these babies who are almost grown up. And these moms' lives hold everybody together. You are a very integral part of your family. You run everything, I'm sure. You're the CFO of your family and your work. and to see you guys become yourselves again, to have everything back and give yourself a second chance is amazing.
Well, you've
And
given
it
me
gives
back my life.
Thank you. Thank you. And I just love that. So.
Thank you.
So thank you for coming today. We appreciate it. And if any of you would like to have more information about BioBalance pellets, then visit biobalancehealth.com or call us at 314-993-0963.